Good Wednesday morning, everyone. We're here today to talk about the temporal lobe of the brain. This is our third segment on brain health for this month of, what are we in now, April. And so we're going to finish brain health next week and move on to something else. But as they always say, repetition is the mother of learning. So if you hear me repeat things, some of the same things over and over, maybe that's what will help us remember it, and it'll stick like glue in our brains. So one of the big things for this temporal lobe is that it's very susceptible to things that make us anxious. And as we've already talked multiple times on these videos, anxiety is a big part of today's world. We have everything from social media to just the news that's constantly bombarding us with information that's maybe distressing, but the world is busy, and so anxiety is very much a part of our life. So I'm going to quiz you. What is one thing that you can add to your diet that will help with that, and what is one thing you can eliminate? I've said it many times. The thing you want to add is protein, and the thing you want to eliminate is excess carbs. So I don't know what year they made the food pyramid, but you remember how with the food pyramid, the base of that pyramid with the most servings was all carbs, right? Breads and cereals. And it turns out that it probably should be tipped right upside down. We need more protein, we need more good fats, and then carbs should be in the form of healthy vegetables, that type of thing, and very little of the grains. So grains inflame the brain. I don't know if there's a book out there called Grain Brain, and it's pretty interesting what gluten and corn and things of this nature do to our brain. Corn is a known neurological aggravant, by the way, and if you suffer from ADD, ADHD, anything like this, you'll find that if you eliminate corn, it can make a world of difference. And even people with seizures, it makes a big difference. Now, corn is a tough one to eliminate because it's in our food in so many ways. It's in our food in the form of high fructose corn syrup, okay, and it's in the form of corn meal, corn starch. Very few people get corn just from an actual corn cob anymore. But I don't mean to bust on corn because I love the taste of corn on the cob, but it's been so genetically modified and changed that it really does wreak havoc neurologically on our system. So when we talk about the temporal lobe, getting back to the temporal lobe specifically, we're talking about the sides of our brain right here. And if you look at a brain, it's kind of neat. It looks like armrests. And in times past, it wasn't thought that the temporal lobe did much, but it really does a lot. It has a lot to do with word finding. It has a lot to do with facial recognition and recognizing and interpreting a person's expression. This is the part of the brain, or one of the parts of the brain, that's really susceptible to traumatic brain injury. So if somebody gets hit on one side, it isn't just this side that gets affected. We need to understand that because the brain is sitting inside our skull. And when we hit this side, yes, we damage this side, but we get what we call a coup contra coup injury, which means the brain actually literally bounces from one side of the head to the other and back again. And so we actually get injury on both sides. So I think people with traumatic brain injury need tremendous compassion because they are often misunderstood. And so if I look at someone in a very serious expression like that with traumatic brain injury, they might interpret that I'm upset with them, when in fact I'm not. But someone who has a healthy brain wouldn't see it that way. They would kind of anticipate, excuse me, that maybe I'm just thinking, or at least not having something against them. So it's kind of fascinating, this part of the brain. So, pardon me. One of the things, like I think I already mentioned, the brain, this part of the brain is very susceptible to anxiety. So how do we handle anxiety? I've said this before as well, but I want you to remember it like a mantra. Anxiety and acidity are like first cousins. They're like best friends. So if your body is acidic, it's also very anxious. Okay? That's how it affects the brain. So how can we combat that? We've already talked about the carbs and the protein, but additionally, minerals. Minerals are huge for lowering inflammation. So how do we get minerals? Well, you can take things like magnesium, potassium, calcium, and those all probably should be a part of your supplement nutrition intake. Minerals are calming. They help us manage stress very well. They bring down an inflamed condition. So many times people will ask me, well, what can I eat that will get me a lot of minerals? And the answer to that is generally foods that are found in the ground. And you can remember that by minerals ground us. They make us feel grounded. So turnips, beets, carrots, rutabagas, things like this. They have potatoes even. Now, potatoes aren't as good for the glycemic index person, but they're good for other reasons. So those are some things that can lower inflammation in your brain. As far as nutrition, you might look at things like ginkgo biloba, fish oil. Fish oil is very anti-inflammatory. It's hard to overstress fish oil. It helps our brain, it helps our heart, it helps our joints. It's anti-inflammatory. It, again, calms that inflammation down, the brain that's on fire. Additionally, you want to manage cortisol. You want to do what you can do to lower stress in your life. Some things you can't lower. You can't maybe change your boss. You can't change certain situations at home. But there's just little things that you can do that help. Taking a little mini vacation every day, 15 minutes to close your eyes or go for a walk or do one of your favorite activities just to totally zone out from the world. These are the biggest things I wanted to bring out to you today. Some of the other things that we find with issues in the temporal lobe, we find sometimes seizures. We find things like periods of spaciness or confusion. Who has that? We find things like social struggles, social skill struggles. Hard to work with other people. We mentioned word finding, auditory processing, listening. So all these things are affected by the temporal lobe. And I hope this was helpful for you today. I'm glad you tuned in. Please join us again next week. We're going to talk about the basal ganglia and the deep limbic system to finish up. A few more fun factoids about that, and then we're going to move on to a different subject in May. So stay tuned. Remember, whether you're 1,000 miles away or right here in our own backyard of Hollister, Missouri, we're here to help you fall in love with the way you feel. 417-336-2620. Goodbye.